It's a pleasure to be back. I really appreciate getting to present here at Plug and Play. My name is Bronwyn Harris. I am a pediatric cardiologist. I'm also a mom of 3 children, one of which who suffers from asthma, and the CEO of Tueo Health. And we're transforming the way that we manage asthma. So I don't really have to go into how it is really exciting, the convergence of tech and health right now. What we are particularly focused on is chronic disease management and how do we use all of this data that is out there, passively obtained data from numerous different sensors that as of now is just data and not driving changes in clinical outcomes. So we have spent our seed round really proving out every single step in this path that I show here. You can't just have data and expect patients or physicians, whichever you give it to just automatically make changes. You need to have specific insights about a disease status, but then not just that, there needs to be an actionable intervention as a result of that status change, or why are you noting that status change? And the interventions, you have to be able to engage patients so they actually make a change and you have improved outcomes. So our solution is currently using sleep sensors, which can measure not only sleep, but actual physiologic parameters. We bring in also environmental data, and from that can give a daily assessment of asthma control. That we have a recent publication and proven out the correlation with asthma control and the ability to predict asthma symptoms. We then can have data-driven alerts with personalized education and actionable next steps, all of this supported by an asthma educator. Why start with asthma? Well, 50% of asthma patients are not well controlled, leading to extremely high healthcare costs. And it's not just about exacerbations, that tip of the iceberg there that have high costs. There's a period in the middle of patients who are not well controlled and may not even realize. They may not recognize they have symptoms and likely aren't taking the rescue inhalers. Those are the essential patients you want to be able to reach and actually have them change their management. Asthma is a complex disease, but there are many drivers and signs, all of which can be measured and used as part of our solution. And then again, as I mentioned, you have to have actionable insights. So we have built this solution to not just give a score and give data, we have next steps. We then just completed a randomized clinical study in partnership with Evidation Health to prove that we can take those actionable insights and actually change clinical outcomes. The insights that we are able to show from our analytics are extremely engaging to the patients, engaging with the change alerts, going through question flows, giving us additional data. And from that, have significant reduction in exacerbation and emergency room visits, the ability to really change the care of these patients. And great user experience. 65% saying the app became a part of their regular routine of how they manage their child's asthma. We have lots of great stories of children whose lives have been changed by our solution, and the families didn't want to give the device back. We are now continuing to launching this fall, both B2B and B2C, and are looking for investors and corporate partners. So come find me and talk to me. Excited about the future of asthma. Thank you.